Welcome to the Outpatient Antibiotic Stewardship, Achieving Core Measures Success in the Community Pharmacy Setting webinar. I am Nikki Kimmer, a registered nurse and project specialist with Lake Superior Quality Innovation Network, representing Wisconsin. Today I am joined by Demi Sokol, lead pharmacist with Hyatt Pharmacy from Milwaukee, Wisconsin. Demi has been working with her pharmacy teams to achieve success by implementing the Outpatient Antibiotic Stewardship core measures. She is here with us today to share her team's successful implementation strategies. The objectives for today's presentation are: describe the core measures of outpatient antibiotic stewardship, explain the steps taken by the pharmacy team to meet each core measure, and discuss successful intervention strategies to improve outpatient antibiotic stewardship in the community.
Thank you, Nikki. Again, this is Demi. I'm going to start with introducing the pharmacy I work for. So Hyatt Pharmacy, we're an independent pharmacy in Milwaukee. We're going very fast. We're at 12 pharmacy locations. We also have 2 telepharmacies in the Milwaukee area, and then we have a few patient adherence programs, which are basically to assist patients take their medications better. The first one I wanted to highlight is medication therapy management program. We have something called as a synchronization program, which we label as Simplify My Medications or SMM program, to make sure that the patients are getting their medications on time in one fill rather than being scattered throughout the month or 3 months, just to help with their compliance. We also do home delivery for patients' medications. And with these 3 programs at Hyatt, we've been able to assist the community to better take their medications and be more compliant. To highlight the core elements of outpatient antibiotic stewardship, we've been working on each of the core elements in our pharmacy to make sure that we're able to commit to the program. So of course, the first element is going to be commitment. When I talk about what actions we've taken, what policies we've put together in our practice to utilize antibiotic stewardship. We've also been tracking and reporting the progress that we've made. And we also make it a point to educate our pharmacists and our staff to keep utilizing antibiotic stewardship. We have a few tools to put together, and also certain areas where the pharmacists can utilize certain tools to build up their expertise. In terms of the first core element that we wanted to share was commitment. So as a community pharmacist, we a lot of times see prescriptions prescribed for patients' infections. There are certain times that we don't even know what the patient's weight is, what the diagnosis is, and we're filling that. So I think it was very important for us to start with demonstrating that dedication to our patients and accountability for this whole project. It was very important to understand how the patterns of antibiotic prescribing, it's very important to understand that and ultimately impact our patient safety. So we've made it a point, and it's a part of all the training that we provide to our technicians, to make sure that every patient that comes into our pharmacy, we have a documented allergy for them. Even if they're not allergic to anything, we want to make sure that it's documented. And we all know that antibiotics are well known to cause allergic responses, and we don't want that to be repeated in case the patient had a past experience or an allergic response to an antibiotic. We want to make sure that it's documented. So all our staff is well aware, and we have a very well established dispensing software where we have a spot to enter a patient's allergies. So it's very important for us to be committed to implement antibiotic stewardship by making sure that we have a patient's allergy documented in our dispensing software. In terms of policies and practices that we've implemented at the pharmacy, we have it very important to make sure that we are following up on every antibiotic that's prescribed to make sure what the patient's taking it for. Is it working? We want to make sure that the patient completed the course of the medication. Was there any reason that they had to modify the way they were taking the medication? can we assist them with other symptomatic relief? So it's very important that, these policies were implemented just to kind of follow up on the commitment core element that we were talking about. We have our own team that kind of follows up with the patients to make sure that the antibiotic was delivered to them the same day. Are they taking it the way they were supposed to take the antibiotics, as I mentioned earlier? So one of that component is, of course, the medication therapy management. We have reports that we generate to our system, and we want to make sure that every patient who receives an antibiotic prescription has completed the course. So on this slide, we have a few examples of our team members who are calling the patients to make sure that they got their delivery on time and they're taking it. And if there's any concerns that they have, if they do have a concern, the pharmacist is happy to triage, answer questions regarding their antibiotics, and if there's any other follow-up that needs to be done with the prescriber. Because it's very common that we see in the community that the patient completed the 2 days, but they didn't take the rest of the dose because they had side effects or they forgot to take it. Or you would see that they left the office, the doctor's office, that they had a prescription, but they forgot to pick it up, or they got too busy and they forgot to take their antibiotic. So it's very important that we make sure that we are calling those patients, having a follow-up, and making sure they're staying on top of their treatment. So as I mentioned, whenever we're making any of those follow-up phone calls, we're emphasizing on any changes in the allergies. Did the patient complete the course? We're also following up on side effects, like are they noticing any symptoms of diarrhea? Are they noticing any other symptoms of their infection getting worse? Have they improved and things like that? And of course, we kind of follow up if it was a child, how has their symptoms been? And we also talk about other symptoms like fever, any other body aches, to kind of make sure that they understand that they still have over-the-counter options that they can utilize till the antibiotic kicks in, because a lot of times parents are not sure what's going on. They're not utilizing other over-the-counter options. So we're making sure that our patients are getting that assistance also. The third core element that we wanted to focus on was tracking and reporting. Well, all the efforts that we're making, it's nice, but we wanted to make sure that it's working. So we also have developed a form at the pharmacy where our pharmacists are trying to monitor the antibiotic prescribing habits. We're trying to make sure that, there's not a specific medication or antibiotic that the patient's been using multiple times. Well, because it's definitely not a good practice. We want to make sure that there's a regular feedback to the clinicians, right? So if this patient's coming back and this patient's been in 2 different urgent cares and their primary doctor prescribed something, they might end up getting the same antibiotic being prescribed within the last 90 days. So that's also something that we report back to a patient's primary doctor. We also have the prescribers update on assessment done by the pharmacy. So if they identify a specific need, if they identify the patient bringing another antibiotic prescription from a different prescriber, we report back to that prescriber and let them know that there's 2 different antibiotic prescriptions. We want to make sure you understand this. And there's been a lot of instances where we were able to change the way the antibiotics were prescribed because there was lack of communication between the patient and the prescribers. So the pharmacist can play a very important role. We also, as I mentioned earlier, assess for antibiotic use pattern in our patients. To ensure patient pickups antibiotics on time, we mentioned about this, that we're running reports to our dispensing software to make sure that the patient received it on time. We do not want any patient to not get their antibiotic on time in terms of was it put on hold, was there a question, was there some kind of drug utilization reporting that happened where the pharmacy was not able to fill an antibiotic, was it too expensive? So there are certain factors that can cause a prescription not being filled on time. Or we didn't have it in stock. Well, could we call the doctor's office and say, can we switch it to something that's available? All those things rather than forgetting about it. So it's very important that we're keeping a track of these antibiotics and making sure that the patient receives it on time. We also make sure that there is no adherence issues reported by the patient, so we can let the prescriber know. Because certainly if the patient did not complete their course of the antibiotic, it's a possibility that the patient has not recovered fully and they might get the symptoms again and they might have to be treated. So it's very important for the prescriber to be aware that there were certain adherent issues with the patient. We have developed, as I mentioned earlier, tools for our pharmacists so they can utilize those tools and stay on top of the program. We also educate our patients on what an antibiotic is, what it's going to do, and why is it important to stay on top of your medication list, to know what health history do you have, what antibiotics have you used in recent past, so you are able to let your doctor know when you're going into a clinic. We are also making sure that we have access to needed expertise on optimizing antibiotic prescribing. So we have different kind of tools that we utilize in the pharmacy. So the one that we are able to utilize is from the Pharmacy Study of Wisconsin, where we have an Excel worksheet for our pharmacists so they can enter which medication they're using, what could be the child's weight to make sure that the child is getting a safe dose, because oftentimes we do not know what the child's weight is, and it's almost hard for us to kind of do it on spot where we are able to get the child's weight and get the dose calculation done, but we want to make sure that it's being safely prescribed. So we've been utilizing that tool in the pharmacy, and all the pharmacists have access to this. So we're not just dispensing whatever we receive, because oftentimes we want to make sure there's no unsafe doses that we're handing out to the kiddos, and the moms are well educated. And on top of that, we also have different dosing equipment that we give out to our patients to make sure that the moms understand the dose, or whoever is going to dispense or administer the child their antibiotic, to understand what's the right dose for the child. So we'll keep going further, and in our pharmacy we have definitely utilized a lot of tools, as I said. We have had the follow phone call program, and I definitely believe that this has really helped us make sure that our patients understand their antibiotics while we're doing these follow-up phone calls. They identify a lot of other medication needs for the patient, so these follow-up phone calls definitely assist with improvement in the quality of life for our patients. We're definitely developing more collaborations with our local prescribers. Initially, when we were calling the prescribers a lot, they were not sure why the pharmacy was, calling me and asking me what the diagnosis is, but now they understand that the pharmacist is doing this as a second step of check to make sure everything's right for my patient, and they're more supportive. So there's more collaboration with the local prescribers, and they understand that pharmacist is not just dispensing what I prescribe, but they're also making sure that this would work for my patient. So initially it was like a little challenge, but I think now the more we're discussing with them, we're getting more support from the local prescribers. And of course, the tools that we've utilized, because once you're working in the community pharmacy setting, it can be really challenging to make an extra step, because you're so busy, you're sometimes not even available to talk to the patient. But it's very important to have those tools to make things easier, so we can go through the steps and then have more time available for the patients to assist them, talk to them, make sure they understand the antibiotic, make sure that they understand what they're taking it for. The pharmacists are also well versed with what other things can be given to them over the counter. So can they talk about probiotics? Can they talk about appropriate use of Tylenol for the children, or even for adults, just to make sure that till the antibiotic kicks in, they have other options to make sure that they have a symptomatic relief. So having those tools has really helped us for the pharmacists to be able to get on board with the program. We have also been working with the urgent care that we have in one of our pharmacies to refer to them for patients for flu and strep tests. The reason is that a lot of times we don't want patients to just get a medication for pills if they don't really need it. So it was very helpful to have that collaboration with the urgent care to make sure that they can get it done on time and get their medication, if it's Tamiflu or any antibiotic that they need, in a timely fashion. So working with them was actually a win-win, because the urgent care was able to support their patients, and they knew that the patient can get their medication right away, and this was actually great for a lot of our patients. And then, as we've been talking about it earlier, educating patients about appropriate over-the-counter use, using probiotics if they notice any stomach-related issues. And of course, we have definitely noticed that a lot of times patients are getting antibiotics that they don't really need, and more tapping, more questioning, more open-ended questions to our patients, and more follow-up calls with the prescribers has really opened up doors for better communication. And we definitely want to see there is a use of antibiotic in an appropriate fashion, and we're trying to cut down antibiotic prescriptions in the cases when there's not really a need for the patient. And we definitely want to make sure our pharmacists are on board with validating appropriate dosing, so we follow up with them regularly. So I think for pharmacists at Hyatt, I think the first step was to make sure that we are advocating for antibiotic stewardship programs out in the outpatient setting or in the community setting. And then, of course, we wanted to make sure that we have some support from the peers, from the case managers, and they really like it when we're following up with them, because definitely if their symptoms get worse and they're not getting their antibiotics on time, they can have worsening symptoms, which can cause them going back into the ER. So that's something that we've really gotten a lot of support on. And this will definitely, as I mentioned earlier, now that we've been making those calls regularly, there's been less resistance from the clinics as well. And this has also opened up gates for more dialogue with the patient about appropriate over-the-counter use. We definitely don't want a patient to be taking 5 products that all have Tylenol and having side effects from that. So that kind of communication has also been way much better. And then, of course, we have a better connection with our patients, which definitely makes us feel as a pharmacist we're able to do our job better.
So as we mentioned, there are several resources available for pharmacies who are interested in decreasing the overuse of unnecessary antibiotics. These resources can be found on the Lake Superior Quinn website, www.lsqin.org/initiatives/ASP. In closing, I would like to thank Jimmy and her team for their efforts in Outpatient Antibiotic Stewardship Initiative. It was a pleasure having you here today to present on your successful intervention. The Hyatt Pharmacy team has been a wonderful partner on this initiative, and we truly appreciate you partnering with the Lake Superior Quality Innovation Network. As we continue to fight antibiotic resistance, know that small tests of change can achieve big results. Thank you for listening to today's presentation.